Welcome to the Swain Sinus Show, a physician and patient discussion on how to better manage and treat mild to serious sinus issues and conditions. From diagnosis, treatment, home remedies, and surgery, Stacy and Dr. Swain will talk about improving your quality of life, breathing easier, and feeling better. Let's take control over our sinuses and allergies so they don't control us.
Hello, Dr. Swain. How are you today?
Good morning, Stacy. How are you? It's good to be here.
It's always good to see you and get to ask you the questions that are always make me go, why does this do that? So thank you for answering my crazy questions.
No, we're glad to be here. I think we're going to talk about sore throats today.
Yes. So let's just jump right in. What is a sore throat?
You know, the easiest thing is when your throat's sore. It's a very common complaint. I think it's one of the most common reasons why people come to see the doctor, whether it's their ENT doctor or the urgent care doctor or their primary care doctor. And so there are a lot of different causes of it. Most are pretty benign. Usually they kind of an upper respiratory tract infection. I've got a viral illness and sore throat. Obviously, there's the things that people heard the most about, like strep throat, which we were talking about beforehand. And sometimes trying to figure out when it's strep throat and when it's not strep throat is a little bit hard. And then there are the other causes too. There's stomach acid reflux that can give you a sore throat. Obviously, cancers, malignancy, one of the things that we always worry about. Not as common a thing as the viral illnesses, obviously. When you wake up in the morning or you present with difficulty swallowing and pain in the back of your mouth, that's kind of the most common reasons why we get called.
And are the common sore throat, is it seasonal or do you see it just year round? Yeah,
year round. I think there are certain times of the year for the I'm sick and I've got a sore throat. Usually that starts about the time kids go back to school, September, October, and then usually runs through until about March or April, about the time kids are getting out of school. The posterior nasal drainage kind of sore throat that gives you the posterior nasal drainage that gives you the sore throat, We'll see that usually in the big allergy times of the year, in the fall and certainly in the spring. It's January right now, and so in about 6 to 8 weeks, we'll start to see things warm up and bloom, and we'll get involved with allergy reasons for sore throat.
There's a bush around here, I don't know what it's called, but when it blooms, my sinuses and drainage all just go crazy.
Yeah.
When I lived in Texas, it was cedar. And when the cedar season hit, it was just everybody was down with allergies and sore throats and runny noses and such. So I'm glad to know that it's pretty common. And,
yes.
Certainly a lot of folks are affected by that. Well, one of the things that I've always wondered about sore throat is I think it's called a lymph node on the side of my neck gets swollen. And sometimes one of them gets swollen, sometimes both of them get swollen. Why is that happening? And does it mean something more than just a simple sore throat?
That's a good question. And so I think when somebody comes in and they've got a sore throat, the first thing you're going to do is try to examine them and get a history. And if the history is, they're basically a healthy person, they don't smoke, somebody in the family's been sick and they've kind of had a sore throat for a couple of days and now they get a really bad sore throat and they feel swelling on their glands on the side of their neck, the lymph nodes are swollen. We generally tend to think that is a more advanced or bigger problem than someone that comes in that's complaining of sore throat and you really don't see much on exam. In other words, their lymph nodes are not swollen, the back of their throat's clear, that kind of thing. So we tend to take other signs or symptoms of the exam into account when kind of assessing the degree of severity. Certainly if you were a smoker and you came in and you've got a sore throat and you've got a big lymph node or big mass on one side of your neck, that certainly raises a lot of alarms from an ear, nose, and throat standpoint. So to kind of go back to the question, when you examine someone, you're looking for certain things regarding their throat. You're looking to see if the exam is normal, are their tonsils inflamed, and then you look at their ears as well, you look at their nose, and then you look at their lymph nodes and you feel their neck as well. Because as we've talked about before, kind of everything in the ear, nose, and throat is kind of connected. And so their lymph nodes kind of, and the drainage pathways are ways that your body is trying to fight infection or malignancy or any other type of problem. And so we examine all the body parts.
So if I'm at home and I wake up with a sore throat and I open my mouth, I look in the mirror and open my mouth up real big and it looks red, when do I know to do some home remedy and when do I know to come see you?
A lot of it depends on the history. If you were fine one night and you wake up the next morning and your throat's red and you think you're coming down with a cold, the home remedies that your grandmother used to tell you about, hot salt water gargling, that always helps. Breathing steam, that always helps. Using over-the-counter medicine, Motrin, Tylenol, that kind of stuff will help. And you can kind of see how that goes over the next 24 or 48 hours, especially if you're not having other problems, if you're not running fever, if you're not having trouble breathing. If it just seems like if it's one of the garden variety, you wake up with a sore throat and you think you're getting a cold, I certainly would start with those kind of the home remedy kinds of treatments. It's when there are other things that are bothering you that you think, okay, well, I can't wait 2 or 3 days to see if this gets better. If your fever is getting really high, if you're having trouble swallowing, if you're having trouble drinking, those are kind of warning signs that there may be something going on other than the run-of-the-mill viral sore throat.
Okay. And you mentioned it briefly, and we've talked before, this strep throat. We talk about a strep is like calling every bandage a Band-Aid. I mean, is strep throat the most common of the more advanced diagnoses, or is it just that that's what we hear about?
I think if we're classifying sore throat or pharyngitis or tonsillitis, depending on what we think the diagnosis is, strep pharyngitis or strep tonsillitis is certainly the most well-known of the bacterial infections. There are a lot of bacterial infections that you can get in the back of your throat. Strep is not the only one. It's certainly the one we test for most often. And over the years, you hear about people that may have had problems from a bad strep infection, whether it's something called post-streptococcal glomerulonephritis, or the term rheumatic fever. Those are all results of a bad tonsil infection or pharyngitis from usually alpha hemolytic strep, streptococcus, which is the full name of the bacteria. So the whether or not we use antibiotics kind of depends on what the diagnosis is. And sometimes it's easy to make the diagnosis. We were talking beforehand. Your doctor walks in the room and you open your mouth up and you say, and they go, oh my gosh, this looks terrible. You need to be on antibiotics.
I've heard that before.
Right. We all have. And so that's easy. That's the one that gets the antibiotics in. And most of those people get better with appropriate treatment. The ones that it's a little harder are sometimes the ones that are having recurrent infections. They come in and say, I've had strep, or my child's had strep 4, 5, 6 times. And those are the ones you think, okay, well, maybe this person needs to have their tonsils and their adenoids out. And then they're the ones, so sometimes it's just hard to tell. Everyone is familiar with the rapid strep culture, the one the doctor comes in and swabs your throat and comes back in 5 minutes and says, you don't have strep. Well, the hard part is when you get down to it is that test is not super accurate. And so a lot of times, if you really need to know, what you'll do is you'll swab the throat and send the culture to a lab, where the lab actually they take the swab and they plate it out on appropriate culture medium, and they try to grow the bacteria that's in your throat out to be able to identify it and to decide what antibiotic you need to try to kill the bacteria. The problem with that usually is that takes about 5 days to do. And in the meantime, you're sitting in there going, my throat hurts, and then I've got this problem. So usually you wouldn't delay antibiotic treatment. At least I try not to. If I really think someone's got a bacterial infection, I'll treat it. To figure out what antibiotic you use, you kind of have to guess a little bit. I mean, the most common things you think about, certainly strep is the most common. And if I'm putting someone on an antibiotic for a sore throat and I don't know that it's strep, I certainly will make that a part of my antibiotic coverage. And which antibiotic you choose kind of depends on what medicines you're already on, what you're allergic to. Sometimes it gets to be a little bit of a challenge trying to pick out what drug I need to put you on depending on what's going on with you.
Well, and that's part of the history you mentioned earlier, is that as patients, it's really important to tell you what all is going on and not withhold information.
Yeah, and just like when we're talking beforehand, sometimes things come out in the course of a conversation. We were joking ahead of time about the old, the doctor thinks the visit's over and gets up to leave and puts the hand on the door, and he or she has got his hand on the door, and the patient comes up and says, well, wait, I got one more thing to tell you. And it's something.
Oh, by the way.
And it's something that's really important that hasn't come out in the course of the conversation earlier. It's really hard in this day when you're trying to be on time and keep everybody's visit on time to be able to get all the information out, because people, when I go to the doctor, a lot of times I'm nervous and I'll be thinking, okay, I need to tell them this, this, and this. And I get in there and it's like a deer in the headlights, and I forget, like what I want to say. And a lot of times it will come to people, and it always comes when the doctor's got
hands on the door.
The hand on the door. And so that's pretty common.
So we've talked about a lot of things today, the basic sore throat, when it might become a little bit more advanced, and certainly some other opportunities that would be more advanced related to, say, gastro or cancer. When it gets to those more advanced levels, how do you proceed with patients?
Well, I think the biggest thing is when people come in and they may have a sense of expectation as to what their problem is. You know, they come in with a sore throat and they'll say, look, I've been on all these antibiotics. I've got some infection here that's not getting better. I've been on these antibiotics. There's something wrong. What is it? And then you kind of have to take a few steps back and think, okay, you know, having a bacterial infection is just one potential possibility. There are other things, whether it's inflammatory from reflux or whether it's a malignancy from cancer. And so you kind of have to you got to step back and try to pull everything together. If you do suspect that something else is going on, you certainly got to be a lot more detailed with your exam. You know, we talked before about the scope, the flexible scope that goes in the nose to look down at the voice box and the larynx and other parts of the throat, or the mirror. You know, we use sometimes a mirror to look down the back of the throat. Sometimes you have to employ all those things. Sometimes you have to get blood work. Sometimes we even get CAT scans. I mean, there are times when you can look on the outside of the skin and you can look on the inside of the mouth, but to see between the two areas, you've got to get imaging studies. Usually that's a CAT scan. Sometimes it's an MRI. But when we're doing those kinds of things, we're looking for very specific, complicated things.
Are there any final thoughts you'd like to share with our audience?
I think the biggest thing is that this is a super common event, and to let everybody know that when you get it, it's not something that's unusual. I think there's a lot of reasons that people go to the doctor, and this is one of the most common. And when you go to the doctor, they're going to try and look at you and decide what's best for you, whether or not that's an antibiotic or whether or not that's, look, this is a viral illness. Let's give this 4 or 5 days on some anti-inflammatory medicine and see if it progresses. You know, try the saltwater gargling. And one of the biggest things that's come up now has been telemedicine, where they can log in and talk to someone online. And most of the time, when they're dealing with a telemedicine doctor, they're prescribed a medication. And a lot of times that's great, and that will solve the problem. But one of the hardest things that I've had to learn over the years is how to practice telephone medicine. You know, when somebody calls in and you're talking to somebody on the phone, it's very difficult sometimes to get an idea of exactly what is going on. And you're talking with someone on the phone, they're not feeling good, but you lose so much of the interaction by actually looking at them and looking in their mouth or their throat and examining them and getting a feel for what's going on. Some of the newer online things that are offered, like telemedicine, are great, but I have a hard time really knowing what's going on without being able to examine someone and look them in the eye and kind of get a sense of, okay, how sick are you? And so I think that one of the things that is so important when you're trying to treat someone and take care of someone is to have that one-on-one interaction, that face-to-face interaction, even though it may be inconvenient at times, whether, you know, you have to go to the doctor and you have to fill out insurance forms and you have to wait in the exam room and then you got to wait to get in. I understand that. And I think a lot of doctors are aware of that and they're trying so hard to streamline that process. But at the end of the day, being sick is not convenient for anyone. And the most important thing is to get someone through their illness in an efficient manner as possible. And so I think the big advantage of one-on-one interaction is you can look at someone and examine someone. And I think that's the best way ultimately, if someone's not getting better with an easy problem, to be able to figure out what's going on. We all work together as a team, and the telemedicine is an exciting new prospect, especially with all the resources that are online. But it can't replace actually seeing someone, talking to them, and examining them. If you've got a bad enough problem, you got to get seen. Right.
Well, that's a good place for us to end. Why don't you tell everybody how they can make an appointment with you?
Yes. My office number is 251-470-8823. I've always got to repeat this because I say it so fast. So it's 251-470-8823. And of course, we have appointments on the website. It's drronswain.com.
Thank you for sharing that today. And if anybody has any questions, feel free to reach out to us and we'll address it in an upcoming show.
Thank you.
Thank you. Thanks for listening to the Swain Sinus Show. Please subscribe to our show on iTunes, Overcast, and anywhere you download your favorite podcasts. Want to know more about Dr. Swain or to schedule a consultation or appointment? Visit SwainSinusShow.com or call his amazing nursing staff at 251 888-470-8823. We would love to hear what you think about the show. Email us at drswain@drronswain.com. Again, thanks for listening. Breathe easy and have a great day. This show is brought to you in part by the fine physicians and friendly staff at Premier Medical Group in Mobile, Alabama.